I'm Sue Babcock, a clinical psychologist at Olmsted Medical Center. In my job, I provide psychological consultation and psychotherapy to adults within the medical clinic setting. Referrals from providers are often for depression, anxiety, and psychological factors that impact medical conditions. When working with older adults and those referred via palliative care, grief is a key thing that I keep in mind. People are dealing with loss of functioning in many areas. Maybe they have recently retired, so there's difference in how they are spending their time and not working anymore. There's loss of functioning in their body just naturally with aging, but if they have been recently diagnosed with a new condition or a chronic medical health problem. They also may have loss of relationships through change in work environment or death, changes in other friends, also having aging-related difficulties, and all of this can have an impact on people's mental health. I find that the power of listening and allowing people to be heard is key, especially as older adults often feel invisible in our society. And on a personal note, my parents, who are in their late 80s, are my next-door neighbors, and this provides me with insight into their experiences with aging, as well as what it is like to be in a caregiver role that families are so often involved in. Yes, loneliness is a normal human emotion, whereas social isolation is not having access to connection with others. So all of us can experience loneliness even if we are in a loving relationship and have friends and family and things that we're involved in, but we still may have times when we feel lonely for some sort of experience or some certain person, which is very different than not being able to go out and have connection with other people. In older adults, social isolation can increase cognitive decline. Through lack of stimulation with conversation and shared activities, the brain is not getting the same practice that it used to. Loneliness and social isolation can also decrease a person's sense of meaning in their life, and trying to help them find ways of still feeling like they are engaged is a key to not having them have increased depression. There also can be increased stress physiologically with social isolation, which can have a great impact on medical conditions. Structure. Anything that you can do to increase consistent ways that people are visiting with others, going on outings, if there are some type of consistent group meetings, whether it be through church or another organization, that people have something to look forward to and to count on. It can be home visits where someone is coming in, or when able to get out into the community is really helpful for the stimulation as well. Technology, while a great way of helping people connect, remember that it can be overwhelming for someone who does not have a lot of experience with it. And if you are going to help people use social media to stay connected, make sure they know how to use it with ease and also safely. Also want to say that a way to get structure is to know what's available in your community. Here in Rochester, Minnesota, there is a great organization that has a fitness center as well as multiple social activities, all focused on older adults. I also wanted to share an example of a way of helping people stay connected. I was working with someone who I met when both she and her spouse were seeing me because he was referred through palliative care. And they moved into a senior community where she was the primary caregiver while they were living in assisted living. And when he needed to move into memory care, Her family helped her decide if she was going to move into an independent living apartment in their senior community or live somewhere else in the community in an apartment. She chose to stay within her senior community, independently living, but having access to meals with other people, going to activities, and still being able to go visit her husband right there within the same community. And she told me she was so grateful for having made that decision and for her family to have helped her to decide to stay there. Empower people. Both older adults and their families are greatly looking for anything that can help them access activities, organizations, anything that will help them have their highest quality of life.